Bismillahirrahmanirrahim. Today I am going to tell you about the attachments of the humerus. Humerus is the bone of the arm and it is the longer bone of the upper limb. You have covered the bony features of the humerus. I am just going to tell you about the attachments. But before going into deep discussion, we should determine what side of the bone this is. This bone is the right side because, or that it is the right humerus because the upper end is rounded and directed medially. Okay, this side is medial, this is the lateral. The upper end has a globular or rounded head that is directed medially upward and backward. Second important thing is that the lower end is expanded from side to side and flattened from before backwards. So this one is the lower end, this one is the upper end, this is the medial side, and this one is the lateral side, because the medial side or in front of the upper end, or the upper part of the upper end has a small tubercle that is called as lesser tubercle, that is coming in from the front of the upper end, and this is also directed in the front side. Okay, the lesser tubercle projects from the front of the upper end and it is limited laterally by the intertuberculous sulcus. Okay, intertuberculous sulcus, or it is also called as bicipital groove. So this is the upper end, this is the lower end, this is the medial side, and this one is the lateral side. Okay, and this is the anterior part of the bone, or we can say it is the anterior border of the humerus. Now going towards the attachments, first of all I will let you know about the attachments on the upper end. So this time come closer to this. This is the lesser tubercle. Okay, the greater tubercle is this one. Okay, this, I'm just tilting the bone. This is the lesser tubercle. On the lesser tubercle, the multipinnate subscapularis is inserted here. This is the insertion of the subscapularis muscle. You have covered all the scapulohumeral muscles and they all inserted over the humerus. So this is very easy at this time that the lesser tubercle has the insertion of subscapularis. Now towards the greater tubercle. I have covered the scapulohumeral muscles and told you that the greater tubercle has three facets: anterior, middle and posterior facet. What muscle is common on the anterior aspect, on the anterior facet? The supraspinatus is inserted into the uppermost impression on the greater tubercle. The infraspinatus is the muscle which is inserted into the middle impression on the greater tubercle. Anterior minor is inserted into the lower impression of the greater tubercle. So we have covered the lesser tubercle as well as greater tubercle. Now the small part or small constriction just below the greater lesser tubercle, or just below the this part. This is the surgical neck of the humerus, at which there is between these tubercles there is intertuberculous sulcus. Okay, this one is the intertuberculous sulcus. You can see the depression. The intertuberculous sulcus has two lips. So this side is the lateral one, so this is the lateral lip, and this one is the medial side, so this is the medial lip. So pect major is inserted into the lateral lip of intertubercular sulcus. Okay, this is the lateral lip and this one is the medial lip. So the pect major is inserted on the lateral lip of the intertuberculous sulcus, and latissimus dorsi is inserted into the floor of the intertubercular sulcus. This is the floor. So on the floor of the intertubercular sulcus is the latissimus dorsi muscle, and then come on towards the medial lip. On medial lip there is the insertion of teres major. This is very easy because you have covered the scapulohumeral muscles. So medial lip, teres major, lateral lip, pect major, and in between them, or in the floor of the bicipital groove or floor of the intertubercular sulcus, is the latissimus dorsi. This was the attachments of upper end and middle of the shaft, or upper part of the shaft. Now come on towards mainly on the shaft. The first muscle that is attaches over the shaft is the deltoid muscle. This is the deltoid tuberosity. You can see here, or you can appreciate here. This is the deltoid tuberosity, and here the deltoid muscle is inserted. Just below that, there is insertion of Brachialis. Here is the medial border, and here the muscle Brachialis. You can see like this. This is the, ये कौन सी साइड है ये दिमाग में रखिएगा. This is the middle of the medial border. ठीक है. On the middle of the medial border, there is insertion of Brachialis. ठीक है. ये anterior border है, ये medial border है इस तरफ को, और पीछे posterior border, lateral border है. ठीक है. So this one is the anteromedial surface. This one is the anterolateral surface, और पीछे posterior surface हो जाएगी. ठीक है. So in the shaft there is two muscles are inserted, that is deltoid and Brachialis. Now we are going towards a large muscle which is Brachialis. The Brachialis arises from this anteromedial and anterolateral surface. Lower halves of the anteromedial and anterolateral surfaces of the shaft are covered with Brachialis. ये सारी जगह मैंने इसलिए इस पे Brachialis लिख भी दिया ताकि आपको पता चल जाए कि this is the origin of Brachialis. Large muscle, large part of the humerus is covered with this muscle. Okay, now we are coming towards the medial and lateral supracondylar ridge, or the lower part of the humerus. On the lower part of the humerus, this is the medial supracondylar ridge, this is the lateral supracondylar ridge. First of all, I will tell you about the origin of Brachioradialis. Brachioradialis arises from the upper two-thirds of the lateral supracondylar ridge. Okay, काफ़ी इसकी बड़ी अटैच ओरिजिन होती है ब्रेकियोरेडियल की अपर टू थर्ड ऑफ द ये जो है ना आपका क्या कहते हैं लैटरल सुप्राकोंडाइलर रिज, इसमें अपर टू थर्ड इज दिस वन by the brachioradialis, origin of the brachioradialis from the upper two third of the lateral supracondylar ridge. Then the second one is the extensor carpi radialis longus. This one is the brachioradius, and just below that on the lateral supracondylar ridge or lower one third of the sublateral supracondylar ridge is covered with extensor carpi radialis longus. I am repeating, brachioradialis, and then below that extensor carpi radialis longus. Okay, this was the lateral supracondylar ridge. Okay, one of the muscle. Now we are going towards the medial supracondylar ridge. There is a muscle which is called as pronator teres. Pronator teres arises from the lower one third of medial supracondylar ridge. This one, this area is covered with pronator teres. Okay, pronator teres arises from the lower one third of the medial supracondylar ridge. ठीक है. Now below that, this is the medial epicondyle. This one is the lateral epicondyle. Medial epicondyle is slightly more projected. On the anterior aspect of the medial epicondyle ridge, there is a common flexor origin. Common flexor, why it is called common flexor? Because the superficial flexor muscles all originate, or all of the, or many of these muscles comes from this surface. So this is called as common flexor surface or common flexor origin, and this is the medial epicondyle, anterior surface of the medial epicondyle of the humerus. So it gives origin to the superficial muscles. Now on the lateral epicondyle, on the lateral epicondyle of the there is a common extensor origin. ठीक है. Superficial extensor muscles comes from this. यहाँ पर इस पूरी साइड्स को कवर किया हुआ होता है. This one, this area, this is the lateral supracondylar ridge, and here all this area is for the common extensor origin, superficial extensor muscles of the forearm, and there is one more muscle, that is supinator, have a common origin from the lateral epicondyle. Okay, be remember this thing. This is the point. You can appreciate, this is the lateral epicondyle, and this is the point where the superficial extensor muscles originate along with the supinator muscle. Okay, this was all about the lower end. Now we will just move towards posterior aspect of the humerus. This is the posterior aspect of humerus. There is a small muscle called as enconius that is arising from the posterior surface of lateral epicondyle. ये मैंने epicondyles अभी हमने cover किया तो easy है हमारे लिए. Here I have, this is the lower end. The enconius muscle arises from the posterior surface of the lateral epicondyle. ठीक है. Lateral head of tricep brachii. That muscle arises from the oblique ridge on the uppermost posterior surface of the radial groove. ये radial groove है यहाँ से. ठीक है, मैं बना नहीं रही क्योंकि फिर उससे आपको मिक्स हो जाएगा आपसे. This one is the radial groove. ठीक है. The lateral head of tricep brachii arises from the oblique ridge on the upper part of the posterior surface. ये जो upper part of the posterior surface है, इसके just above the radial groove is the lateral head of tricep brachii arises. Okay, the medial head arises posterior surface below the radial groove. ये सारा का सारा medial surface of the tricep. इसके ऊपर लिख भी दिया है. This is the very largest muscle which is covering the posterior aspect of the humerus. Here the muscles attachments has been finished. One important thing which you have to know in Viva is the capsule attachment, which is very important. The capsular ligament of the shoulder joint or the capsule of the joint. We should know about that. This is the head of the humerus. The capsule is attaches over all of the anatomical neck of the humerus like this. You can see I am just putting black marker on that, and just you have to move 2 millimeter below in this area. The capsular ligament shoulder joint is mainly attached to the anatomical neck except on the medial side, where the line of attachment dips down by about 2 cm to include a small area of shaft within the joint cavity. This one. Okay, you can see, just I put the marker 2 millimeter below. Why it is like this? The whole of the anatomical neck is covered with the joint capsule. It's like this. Okay. Why it has happened? Because there is a tendon of long head of bicep brachii that leaves the joint cavity through this space, and during abduction, this is very important that it will give space to that. Okay, once the hand is abducted, so it will protect the tendon, and abduction will be easy. So you should remember that the capsular ligament of the shoulder joint is attached to the anatomical neck except on the medial side, where the line of attachment dips down by about 2 centimeter, like this, about 2 centimeter, to include a small area of shaft within the joint cavity. Okay, so this is the capsular attachment of the upper end. Now the lower end. The capsular ligament or the capsule of the elbow joint is attached to the lower end along the line that reaches the upper limits of the radial and coronary fossa anteriorly. Okay, radial and coronary fossa anteriorly. मैं black marker से show कर रही हूँ ताकि आप लोगों को पता हो. Okay. Coronary fossa anteriorly and the olecranon fossa posteriorly. ये देखिए लाइन यहाँ से उधर जाएगी in separating the medial lateral epicondyle. Medial lateral epicondyle के करीब से नहीं जाना. ठीक है, in covering like this. ठीक है, and the olecranon fossa posterior so that the fossa lie within the joint cavity. So the line of attachment passes between the medial epicondyle and the trochlea. On the lateral side, it passes between the lateral epicondyle and the capitulum. ठीक है, lateral epicondyle ये है. ठीक है, lateral epicondyle और capitulum के इधर से गुजर जाएगी और medial epicondyle में नीचे से गुजर जाएगी. So the medial lateral epicondyle has been separated. Why? Because it gives attachment to flexor and extensor muscle जो मैंने भी आपको बताए थे. So joint capsule की जो attachments हैं वो इस तरह हैं. Important thing एक और है, that is the contents of the intertuberculous sulcus. ठीक है, in between these tubercles there is the long head of the bicep brachii. ठीक है, that passes between that, and there is an ascending branch of anterior circumflex humeral artery, which is also very important. So you should remember the contents of the contents of the intertuberculous sulcus. And there are three nerves which are related to humerus, and they are very liable to injury. Is the axillary nerve at the surgical neck of the humerus, radial nerve at the radial groove here, at the radial groove. Okay, and third one is the ulnar nerve that is passes behind the medial epicondyle. Okay, behind the medial epicondyle, ulnar nerve. Okay, they are more prone to injury here. So this was whole about the attachments of the humerus. Now I am going to tell you about the ossification of the humerus. The humerus ossifies from one primary center and 7 secondary centers. I write down here. The humerus is ossified by one primary center and 7 secondary centers. The primary centers appears in the middle of the diaphysis during the 8th week of development. ये मैंने यहाँ पे लिख दिया. During the 8th week of intrauterine life, the first primary centers appear. Okay, now going towards the different 7 secondary centers. अपर एंड एंड लोअर एंड के मैं सेकेंडरी सेंटर्स लैदा कर दिए मैंने इसमें, ताकि आपके लिए इजी हो जाए. So the upper end has ossifies from 3 secondary centers, one from the head, one for the greater tubercle, and one for the lesser tubercle. They fuse together on the 6th year and then forming the compact epiphysis, which fuses with the shaft on 8th year of life. Then we are going towards the lower end. The lower end has 4 centers, 4 secondary centers, one for the capitulum and lateral flange of trachea, second for the medial flange of trachea, and third for the lateral epicondyle. They all fuse together in 14 years of life. Okay, and then compound epiphysis is formed, which fuse with the shaft at 16 year of life. Then this medial epicondyle, इसको मैंने अलग इसलिए किया क्योंकि it is formed by separate epiphysis. These three join together to one epiphysis, and then this will form by the separate epiphysis. So it fuse with the shaft on 20th year of life. So this is the whole ossification of the humerus.